Ladies and gentlemen, welcome to Community for Immunity, Partnerships for COVID-19 Vaccination Programs. Over a year through the pandemic, vaccines for COVID-19 have been developed and tested worldwide. In the Philippines, 2.13 million doses have already been given, with a total of 343,000 Filipinos being fully vaccinated already, as recorded by our World in Data by May 5, 2021. As there is an urgent need to efficiently distribute the vaccines to the most vulnerable populations, the local government of Quezon City, having the highest total of COVID-19 cases in the country, launched several hubs across the city. In support of the vaccination drive, the University of the Philippines, Diliman, located in the same city, partnered with the local government to launch Bakunahan sa Diliman, or Vaccination in Diliman. And the academic institution offered its facility, particularly the College of Human Kinetics Gymnasium, to serve as one of the biggest vaccination sites catering to UPD personnel and select UP campus residents. And the UP-CIFAL Philippines, through this webinar, will showcase how other institutions, in this case the academe, can partner up with local government to combat COVID-19 and contributes to the ultimate goal of herd immunity. And this webinar will also be an avenue for government officials, the academe, medical institutions, and other partner institutions to discuss how partnerships can take place to develop more efficient programs for COVID-19. And hopefully, this webinar will associate the power of partnerships to the fulfillment of the UN Sustainable Development Goal number 3, good health and well-being, 11, sustainable cities and communities, and 17, partnerships for the goals. And hopefully, after this webinar, the participants and our viewers will be able to discuss how local government and other institutions like the academe can tie up to launch programs to combat COVID-19. And to kick things off, let us all welcome, for her opening remarks, a board member of UP-CIFAL, none other than the Quezon City Mayor, Joy Belmonte.
To the University of the Philippines International Training Center for Authorities and Leaders, or UP-CIFAL, the organizers, guests, and all participants, my warmest greetings to all of you as you gather to discuss the most pressing issue of today, the COVID-19 vaccine rollout in the country and its profound impact to every sector of the society and your respective communities. It's been more than a year and 5 months since the first case of coronavirus disease was recorded in the Philippines, and since then, our lives have never been the same. Admittedly, some of our original plans, which we were supposed to have undertaken last year, were pushed back. The unprecedented challenges compelled us to activate our fight or flight response instead. Thankfully, this March, we received the good news that the gift of science to us, the COVID-19 vaccine, has arrived in the country. We began to shift from full survival mode to plotting, once again, sustainable programs, including the non-discriminatory distribution of these vaccines. Our hope is growing. Finally, a glimmer of light at the end of the tunnel. But we should not forget that these trying times have led us to forging stronger ties within our communities. This adversity showed us that what we have is each other, and that we can do anything with a sense of collective action. I am optimistic that today's Community for Immunity will emphasize the importance of our newfound appreciation to building partnerships and the speed at which sectors come together to respond, save, and uplift lives. This is no longer just about returning to business as usual, but how we can flourish towards a deeper and more meaningful healing. Having said this, Quezon City is truly blessed to have your active participation, especially in providing this platform so we can sustain the positive changes unfolding before us. We guarantee that you'll always have our support for your fruitful endeavors. I, together with the Quezon City Local Government Unit, wish you all a productive webinar. Thank you at mabuhay po tayong lahat.
Thank you very much, Mayor Belmonte. And now to kick things off, let us introduce to you our first speaker. He is a three-term city councilor of the Quezon City local government from 2004 to 2013. After being a city councilor, he was appointed as the assistant secretary in the office of the president and became the lead coordinator for the local government support for the Asia Pacific Economic Cooperation, or APEC. In October 2015, he was also appointed as a member of the board of directors of the Base Conversion and Development Authority, or BCDA. He is the assistant secretary to the mayor, head of investment affairs office, and officer in charge of the Quezon City Tourism Department. He oversees the collaboration of Quezon City LGU with the private sector in pursuit of its goals, and also serves as the primary representative of the city mayor between the private sector and local government for multilateral and socioeconomic development-focused entities, including foreign and local investors. Currently, he is on top of the Quezon City effort against COVID-19 and spearheads the implementation and deployment of COVID-19 vaccination plans in Quezon City, particularly Quezon City Vax to Normal. Ladies and gentlemen, let's all welcome the co-chairperson of the Quezon City COVID-19 Task Force, Mr. Joseph Emil Cuico.
Good afternoon. Good morning, Dr. Dexter. Good morning to everybody, the entire community. Good morning also to Dr. Edna po. Thank you for this privilege to speak to all of you. If I can start, may I have my slides, please? Wait just a minute. We're having some technical difficulties. While waiting, just first of all, I'd like personally to thank also with the mayor, the UP community, particularly the partnership that we have. I see Mama Lely with the use of the UP Human Kinetics. So far, we've been rolling out at the moment vaccines, and rest assured, I promised and I gave assurance that once we get a regular supply of vaccines coming from the national government and also vaccines that we have purchased, we will also give a fair share of vaccines to the UP community. And I also reminded the UP community if they can also adopt communities nearby so that we can also have a good reach or a greater reach of people that we need to be vaccinating in Quezon City, because the target, hopefully by October, is for us to reach that immunity. So here is now my presentation. It's called the QC Protectodo sa Bakunang Sigurado. First of all, I will just start with all our initiatives when COVID started here in Quezon City. Well, one is Quezon City has its own molecular laboratory wherein we're doing around 1,000 to 2,000 tests per day. Aside from that, we also have a mobile testing vehicles or mobile testing units. We have two of these where it goes to the far-flung areas. And so far, this has been very effective for us to monitor COVID cases all over the city. Okay, next. The Quezon City government also is doing our free swab test. You can also book online for a free swab test. Just go to our website. We have around 20 community-based testing sites or CBT sites located in different areas in Quezon City that is ongoing as we speak. Okay, next. At the moment, Quezon City has swabbed 254,151 of our citizens. And definitely, if we have to swab more people, we are ready. We have the supply, we have the laboratory, and we have the mobile access and community-based testing sites for people to go. And these services are all for free. Okay, next. With the increase, with the COVID scenario that we are in now, and also now with the vaccination, we also increase the salaries of all our physicians, nurses, and allied personnel. From 35,000, it is now at 59,000 for doctors, for MDs, for nurses from 25,000, we moved it to increase it to 32, and for allied, we moved it from 15 to 17,000. This is to entice more people, more medical practitioners to come to Quezon City, given the need. At the same time, we also understand that with any risk, there should be a higher reward. So we also, that's the reason why we increased their salaries. Next, please. So at the moment, we also, during the height of the pandemic, we serviced around 500 plus medical practitioners, wherein we rented, or if not, got a number of hotels and motels for them to stay in, so that they don't have to travel back home, given the strict quarantine measures. So this helped us a lot in terms of giving more care to those people that are in our quarantine facilities. Okay, next, please. With that also, given that there was a shutdown when it was in the height of ECQ, the Quezon City government also had our Libreng Sakay, and up to now we still have this. This served around good for 1,000 medical healthcare workers, not just in the government or public-owned hospitals, but also all the private hospitals were using this type of system so that they can reach their hospitals and give care as soon as possible to those people who are sick. Okay, next. So with the rise of COVID cases and the surges, Quezon City government now has a total of 11 HOPE facilities, with a bed capacity of over 3,000. Even prior to the surge, there were a number of HOPE caring facilities that were not activated. The mayor made sure that even if there is a downtrend of cases, let us still prepare for a surge. So with the surge, all of our citizens that cannot quarantine themselves, we have enough bed space at the moment to take them on, and we make sure that all of our quarantine facilities are comfortable, livable, and provide the necessary care that needs to be given to all of our patients that are sick in our quarantine facilities. So at the moment, we have about 3,000 beds available for those that are COVID positive. Next, please. With that, for us to find out who are the positive patients all over the city, the Quezon City government, led by our CESU, now has around 3,423 contact tracers. The ratio that we have is for every one positive, we are able to contact trace 15 close contacts and secondary contacts. We're trying to ramp this up by also doing different modes of contact tracing. Aside from person to person, we're also doing phone contact tracing as well. We've been very busy during the time of there was a super spreader event in certain community pantries and also distribution of goods. And so far, with our contact tracers, we were able to identify a number of positives. And with that, we were also able to lock down certain areas where these positives come from to contain the virus from spreading. Okay, next. Quezon City government also incorporated our Safe Pass or QC Pass, wherein we mandate all establishments to install this application. And this has been very helpful in notifying them if they are a close contact of a person who is COVID positive. This is one way of reaching the public and informing them, and also one way of containing if a place needs to be contained. Okay, next. So far, with the implementation also of the lockdown that I've mentioned, we've already done 329 special concern lockdown areas. These are based on cases that our CESU would discovered, clustered cases. And with the lockdowns, we've already had around 3,051 confirmed cases from these areas, and all of which have been properly contained. Okay, next. So with any action, we also need to provide ordinances and executive orders to guide our people. So I will not go to detail with the different ordinances and executive orders that the mayor has issued. But you can see here, these are practically basic also, from wearing of face masks, following minimum health standards, public safety hours, and our localized community quarantine. Next, please. Aside from this, there's the QC pass or liquor ban or public safety hours from 10 to 5 p.m. and so on and so forth. And what we do is, instead of one way of calling the attention of people that have violated the minimum health standards, we would issue OVRs or ordinance violation receipts for them to be warned, or if not, for them to pay a fine, and then after which they go to Quezon City to address, or if not, if they would like to contest, they can contest, or if not, pay the fine that was issued to them. Okay, next. So now let's go to our plan for Quezon City vaccination. This is our Quezon City vaccination rollout. Back in December 3, 2020, given the size of the city and the magnitude and scope that we have to undertake to vaccinate a number of people here in Quezon City, the mayor saw fit for us to establish the Quezon City Task Force Vax to Normal COVID Master Plan. With this, this is more like an all hands on deck type of approach, given that this is a novel rollout, and that because of the magnitude, we really need the cooperation, not just of the local government, but the different sectors in our community, in our city. Okay, next. So with that, we spread it into 4 parts: supply chain, supply and community, supply and cold chain management, immunization, data management, and communications, all of which are working hand in hand together for the successful rollout of our vaccine program. Okay, next. With that, also the Quezon City government, in partnership with a tripartite agreement, has also ordered 1.1 million doses of AstraZeneca vaccines. Hopefully, I just got word that these vaccines will arrive in the second week of July. Not all vaccines will be arriving at the same time. It will be coming in trickles, but definitely this will help us in our endeavor to vaccinate as many Q citizens as possible. Okay, next. So what we did also in Quezon City, given that the process given to us first was with DOH was a 5-step process, we also simplified our process in Quezon City to make it 3 steps, because the idea of the mayor here, what she wanted to do is, we should not have any of the people or our citizens to be in a vaccine site longer than possible. At first, that was the problem we had around late March, early June, wherein we got complaints that people were in the vaccine site at 3, 5, 6 hours in a day. And when she heard that, that is unacceptable to her, because we do not want to unduly expose our citizens and make our vaccine sites into a super spreader event. So with that, we collapsed some of the steps, and the duration and time is written there. And the target is for our citizens to be in a vaccine site to around 30 to 45, and depending on the volume, sometimes it can reach maximum of 1 hour. But any minute more than an hour is unacceptable to the mayor. So we are trying to address this day to day, and we would like to give a wonderful experience to our citizens when they get vaccinated in the city. Okay, next. So there are 2 options to get vaccinated in Quezon City. One is through our online platform, Easy Consult website, and the other one is assisted booking, wherein you can coordinate with your barangays. When vaccines are available, they are now putting up a master list identifying if you are an A1, A2, A3, A4, or A5. And once a vaccine has arrived to their barangay, depending on the number of vaccines, they can call or coordinate with the person that registered, and then we tell them when and where they will be vaccinated. Unlike with the Easy Consult or online platform, they get to choose the time, date, and venue where they will be vaccinated. But this all depends, just like I mentioned in assisted booking, bookings online are available as long as slots are available. So we highly depend on the number of vaccines that we have in Quezon City for us to open slots both in assisted and online registration. Okay, next. So one of the areas that we're trying to focus on now is when we open up A4 vaccination, we also have a program for them to be vaccinated. The two programs that I mentioned earlier are assisted booking and online registration. Another is through our QC Protectodo website, wherein companies with 50 to 100 employees can register, give their master list, and once vaccines are available and a site is available, we can schedule for them to be vaccinated in a city-operated vaccine site. But if they have their own medical team, their own vaccine site, all we have to do, the city government led by our QC Health Department, will go to their dedicated vaccine site to check that if it's feasible, then if there are available vaccines, then we can give them the vaccines and they can administer. So far, we have the Small Business Department, MDAD QC, Quezon City Tourism Department, and also BPLD who are helping us in our endeavor, and also our Office of the City Mayor. Last night, I don't know if you watched the news, we also launched our Bakuna Nights here in Quezon City, wherein it serviced A4 workers. We coordinated, or companies coordinated with us for us to roll out. The reason why it is also Bakuna Nights, because we also considered, the mayor also felt that a good number of A4s are not able to go to our vaccine site during normal office hours from 8 to 5, because she is afraid that majority, or if not a good number of workers might lose pay given that they are daily wage earners. So we decided to open a vaccine site that operates from 3 to 9 o'clock and hope till Saturday, and hopefully next week we will roll out again depending on vaccines available, and we plan to extend this till 11 o'clock in the evening. Aside from Quezon City Hall, we're also looking at another site somewhere in Fairview and Novaliches, because there is also a fair amount of A4 workers in that area. Okay, next. So far in Quezon City, we have already vaccinated a total of 389,136. That is equivalent to 21% of our population. And we have already and vaccines deployed, both first and second dose, is already at 513,881. We have already reached the 500,000 mark. And with the normal supplies of vaccines coming up, we can roll out faster, and also with the help of UP and private sector, we are happy to take on the challenge. Okay, next please. So for first dose administered, it's at 389,136, that's 22%. For second dose, it's 124,745 with a total of 511,000 in the previous slide. Next, please. So far at the rate that we are going, our target is to be done since we started around around March 22. If we continue this rollout, and hopefully we can increase further by around October 2022. That's the time that we are able to reach our target to vaccinate around 1.7 million people in Quezon City, 1.6 to 1.7 million people in Quezon City. But at the end of the day, this always will depend on the vaccines available. The target is October. If we can do it sooner, the better. Next, please. So with the partners and with the private and different organizations, here they are. I hope this is complete, but if I fail to mention some of them, I know that they will understand. Okay, next, please. We have different private groups now, from Ayala, Robinsons, BPO companies and our organizations, hospitals, universities. We have 80 homeowners associations where we also do homeowners vaccination. Special thanks definitely to Araneta Coliseum. because we've been using Araneta Coliseum for the past 2 weeks and going 3 weeks already. This is free of charge. They even help us with the manpower composition because definitely if they can give us manpower, then we can spread out more people to be vaccinated in different areas. Ayala Corporation, they have been providing us with 6 to 7 health teams that we've been deploying in different areas. BPO companies, they got their own vaccine team. And given we are the city with the largest number of BPO companies. Once there are vaccines, they're willing to vaccinate the thousands of employees that they have. Definitely, the hospitals are always there to help assist us. And also the 2 schools, particularly University of the Philippines and Ateneo de Manila, have been constantly assisting us in our vaccine rollout. In the more or less 80 homeowners associations, we thank them also. Majority of them have been providing their own medical teams, and we have been providing them vaccines. So as you can see, Quezon City, we have to have multiple approaches to reach the greater number of people that are willing to be vaccinated. Okay, next. So also special shout out and thank you to both dioceses of Cubao and Novaliches. We have been using their churches and they've been helping us with manpower, encoders, also medical practitioners, and we've been using a number of their churches already as vaccine sites, may be temporary pop-up or permanent sites. So thank you very much also to them. Okay, next. Next, please. So we have, as I said earlier, we have a multiple approaches and initiative for the vaccine rollout. So we do house-to-house vaccinations for those people who are senior citizens or bedridden. We also have a mobile vaccination center. This has been rolled out already in Barangay Payatas and Barangay Holy Spirit in a number of barangays. Especially the target is for this bus to reach A5 or the indigent population, and we'll be rolling this out very soon again. We also have a drive-through. That one is ongoing now. We already have at least 4 drive-through sites. So far, this has been very popular, especially for senior citizens who are afraid to leave their house. So since they don't have to step outside of their car, this has been very convenient for them. We also have our Bakuna night rollout. We will have another one tonight. These are all pre-registered as long as the companies have already coordinated with us. We try not to encourage, or we do not encourage walk-ins in all our vaccine sites because we do not want to turn these vaccine sites into super spreader events. Okay, next. So next, please. With the increased capacity of our vaccine centers, next, please. We have originally the target is to have 24 sites, but given the demand, Quezon City has already a multiple of 131 sites that can be operational depending on need. These are from the permanent sites, district sites, hospitals, malls, pop-up sites. These are for 1-day, 2-day sites, and all the GOCCs or national government hospitals. We also consider them sites that we can operate and inoculate people that want to be vaccinated. Okay, next. So that's my presentation today. I hope I was able to shed light on the rollout here in Quezon City. Rest assured, the local government led by Mayor Joy Belmonte is trying to move heaven and earth for us to vaccinate as many people as we can. As you know, Quezon City is the largest city, the most number of people that has to be vaccinated, the most number of people that are also complaining to be vaccinated. And we're trying to address this day by day. And all we are seeking is patience for everyone because we are doing everything humanly possible to vaccinate people as quickly as we can. So with that, thank you very much and good morning to everyone.
Thank you very much, Councilor Huico. It was very enlightening to see the efforts of Quezon City in order to help address the plague of COVID-19 in our area. And now we move on to our second speaker for today's discussion. And our next speaker actually received her Bachelor of Science in Chemical Engineering Master's in Community Development, and PhD in Education, major in Anthropology and Sociology of Education from the University of the Philippines, Diliman. She currently teaches the undergraduate Development and Doctor of Social Development program at the College of Social Work and Community Development, also at the University of the Philippines, Diliman. And currently, she serves as the Vice Chancellor for Community Affairs of the University of the Philippines, Diliman. Let us all give it up for Professor Aleli B. Bawagan.
Maraming salamat, Dr. Dexter. Magandang umaga sa ating lahat. Good morning to everyone here in this webinar. It is a pleasure to be able to share with you the partnership we have with Quezon City regarding the vaccination. Although based on Sir Vico's presentation a while ago, I'd like also to mention that we have Hope 7 on campus. That is a isolation facility. I think we started that with Quezon City and Philippine Red Cross in April. We are using the CAMIA dormitories since there are no students, very few students on campus now in dormitories. And CAMIA is one of those that is not occupied. So we made it available for Philippine Red Cross and Quezon City Health Department. That's Hope 7 Community Isolation Facility. But for this morning, I'd like to share with you the partnership we have with Quezon City, for the bakunahan sa Diliman, the UP-CHK Quezon City vaccination site. And can you see my slide? Yeah. So this is the logo we made for this program. The Alibata letters you see in the middle can be read as bakuna, and the one on top is UP. So we started talking with Quezon City officials in February 2021, and we procured how we could do the vaccination of our own constituents, and if we can also do procurement of vaccines with them. We offered our vaccination site, but that did not somehow materialize as early as Feb. We were not able to do anything concrete yet. Then we had parallel meetings with Unilab, IP Biotech, and Bharat in Feb and March. I think one of the questions posed to us by Quezon City then was how many people we wanted to be vaccinated in UP Diliman. So we conducted a survey in Feb. Mid-March, the UP system also conducted a survey. At that point, we thought we will do the procurement with UP system and not separately as UP Diliman. However, that also did not yet materialize. And when we heard that Quezon City was doing the rollout in late March, we again continued the talks with them. The challenge at this time for us, early April, was if we could already set up a vaccination center in 2 weeks' time. We had a visit to Piñahan Elementary School, one of the first early few sites that Quezon City had. And after that visit, we started doing our preparations for the site. And Quezon City did the inspection in April 15. So we discussed this as among the deans. And the goal, we said, was to vaccinate as many people as possible, not just among us, but also, of course, the larger community around us. And of course, Quezon City committed to provide the vaccines for both UP constituents and surrounding communities, while we provide the logistical support and the personnel and the volunteers to operate the whole vaccination site. Initially, we expected to operate for 2 to 3 months until this month. But in a talk with Sir Vico a few weeks back, it looks like we have to extend the services at least until September. And we're open to do that, to extend the services until September. How do we operate this center, our vaccination site? We start, of course, volunteers start coming in by 7 a.m. We operate from 8 to 5 only, but the schedule, I think, is only around 3:30 p.m. We allot time for people to be there at the post-vaccination area. The number of days, of course, really depends on the availability of vaccines from Quezon City. Initially, we only had online registration, no walk-ins. But we provide assistance to those who want to register on site, especially those who don't have access to emails or to the website. So we assist them in registration. However, there are cases, I think 2 or 3 days when there were no shows from Quezon City barangays. And since the vaccines were there, we said that maybe we can call people who live on campus or those who are next online and can easily come to the vaccination site in a matter of 10 or 15 minutes. So I think we're able to do, I think, around 30 or 40, depending on people who are available on that afternoon to get their vaccines. We are able to operate the vaccination site largely through volunteers who run all of the vaccine stations. We have two groups of volunteers. First, we call the community volunteers, those who operate the help desk, orientation, and registration. And they come from UP employees. Many of those who work from home, they want to volunteer in the vaccination site. Some students who are over 18, some community members like community vendors. Of course, many alumni also come to volunteer. And the second set are the medical volunteers. These ones are quite difficult to find. So when they volunteer, we really grab their services. No, they are the ones assigned for vital signs, for screening, for vaccination, and post-vaccination monitoring. They also come from alumni, from PGH interns. Interns are assigned to the vaccination site as part of their community station or community section. Employees, staff of our University Health Service, and our Molave isolation facility, and a network of doctors who have volunteered to work with us. We did this call for volunteers in mid-April. We did a volunteer orientation online and close to 1,000 signed up to volunteer. Talagang masaya kami doon. Many people want to render their services through this vaccination site. We also did volunteer orientation on site for them to have a feel of and look of the vaccination site and how it will be operated. So one side is on the left side is a orientation for community volunteers. Another side is an orientation for medical volunteers that's managed by a medical doctor. We also do a daily orientation and debriefing for the volunteers. In the morning, we would tell them how many vaccinees we target for the day, who are the volunteers in each station. And at the end of the day, we will do a debriefing if there are any problems per station that they encountered and how we can address that and how we can improve the operations for the next day. So this is a very good, it's not quite a long orientation, something like a 15-minute and 15, depends on the problems encountered at the end of the day, 15 to 30 minutes of debriefing among volunteers. Of course, we needed to do a lot of resource mobilization. Quezon City provides all of these vaccines and paraphernalia thing like syringes, cotton balls, Band-Aid, etc. Of course, waste management is also done by Quezon City. Quezon City helps us with meals and vaccine carriers. UP, of course, allocated budget for supplies like alcohol, masks, PP apparatus, thermal scanners, oximeters, some meals also, some honorarium, printing expenses, and office supplies. We borrowed a lot of equipment from different UP units. We did not have to buy these anymore. We borrowed monoblock chairs. We borrowed laptops and monitors. We borrowed a lot of freezers and refs. Some refs are there in the vaccination site. Some freezers are there only in the laboratories, like the freezers for Gamaleya. We did not transfer them anymore to the labs. We put the Gamaleya there in the freezers in the MBB laboratories. We borrowed TVs for orientation. We borrowed wheelchairs for elderly who are not able to freely walk around kasi medyo malaki. The gym is quite big. It's 3 basketball courts, so it's quite huge to transfer from one station to another. We borrowed generator sets just in case we have electric brownouts or rotating brownouts, but both until now we did not have any. We borrowed an ambulance, always there on standby, a lot of electric fans, dispensers. We also have 3 beds in our post-vaccination area in case there are vaccinees who need to rest after vaccination. We also got donations for wheelchairs, giveaways after the vaccination. We got giveaways for biscuits and milk. Donations also for alcohol spray bottles para maraming tulong-tulong talaga to put this vaccination site operational. So these are some of the pictures. On the left, you see cars bringing in the refs from a laboratory. We have this monster fan in the post-vac area. We have big 2 helicopter fans on sa roof ng gym, and some of these donations. So the vaccination flow, we have signages for people who do not know where the gym is. And this is outside the gym. Talagang people, there are many who come to rest muna, or let's say waiting area. And we have this huge tarp. And this is the entry where people get their thermal temperature and alcohol. And this is the help desk. In the help desk, we ask if people are if they are on the master list, and if they already have forms signed with them. If not, we give them the forms that have to be accomplished. If it is if it is Quezon City communities that are to be vaccinated for the day, people from the office of the city mayor or the barangays are the ones on the help desk. First step, of course, is orientation. That's where the picture on this one is a volunteer helping people fill up their forms. So we have the consent form, screening form, and validation form. So I think it's groups of 3 or 4 people that they orient in filling up the forms. And after that, they go to step 2, which is registration. You can see people here looking at their what is encoded in the master list. So Quezon City barangays gives us a master list of people to be inoculated for the day. We encode that in the VIMS master list that we have. Some of the forms are not complete, so we still ask them to provide us more information like birthday, addresses, etc. After they get their after all information is complete in the registration desk, they go to vital signs. So these are the pictures at the bottom where they get their BPs and their oxygen levels. Although Sir Vico has told us if we could change it a little bit, so this happens somewhere at the end of the line. Step 3, screening, where the doctors finally say whether they are eligible for vaccination or not eligible. Sometimes they rest here if they have high BPs, blood pressure. And I show you here some pictures of the freezers that we have on site. The one at the bottom is just for 2 to 8 degrees Celsius. That's for AstraZeneca and Sinovac, while the one picture on the right is for Gamaleya. This freezer has to be at least minus 18 while they are on site. Well, as I mentioned a while ago, the Gamaleya freezer is in the laboratory. In the morning, they are transported to CHK, but they are still stored in a freezer at CHK. So vaccination happens here, and then they wait a while, at least 15 minutes for their post-vaccination. It can go longer at 30 minutes if their BP still is at a high level. For quite some time, we had some milk and we had some biscuits as giveaways to vaccines. We also vaccinees. We always remind them to do their mask, wear their mask properly, and maintain social distancing. I still show you here a few pictures when the vaccines are delivered to us. It's accompanied by police escorts. When we first had our Gamaleya rollout, there were a few people from Quezon City who observed the process, especially since Gamaleya comes to us in solid form. It has to be thawed. I think now it's thawed for around 15 to 17 minutes. So we always have temperature thermometers in the freezers, so we are sure that the temperature is okay. We have a master list, no? We have IT personnel who send out emails to UP people. We send out emails, and once they confirm their vaccination, especially since nowadays that Quezon City already has other sites, some of those who pre-registered with us said that they will not anymore avail of the UP vaccination since they've been inoculated elsewhere. So that's a good thing. We don't include them anymore in the schedule. For those who are for those who will be included in the schedule, we send them another email to confirm their vaccination time slot. So we do it every 30 minutes, 8:30, 9 o'clock, 9:30, so they don't crowd. Unlike how it used to happen before, that people crowd at 8 a.m. because that was the only schedule given to them. So we want to avoid that crowding. So we give them every 30-minute schedule, and so far it has been followed. And even the barangay also observes that schedule already. Unlike the first time we had a vaccination with the barangay, crowding at 8 a.m. or even 7:30 a.m. It was already crowded, and we wanted to avoid that. So the next day that we had the vaccination with them, we already followed this schedule. So the last paragraph says, for barangay assisted vaccinees, we request for a copy of the data on the list of vaccinees, so this can be encoded in the master list, and they are likewise emailed, and text blasts are also given to them for their schedules. Data encoding based on VIM's requirements. We also have daily statistics. We have real-time monitoring of vaccinees, like a target for the day, those who have checked in, endorsed, and vaccinated. This used to be our real-time monitoring, but we've changed that now to something more simple. Number of scheduled for the day, number of people who have checked in and endorsed for vaccination, discharged, and postponed or deferred. We also have, for our own statistics, we have a dashboard. And as we said the last meeting with Sir Vico, we're willing to share this with Quezon City if you need to have this system also installed in some of your vaccination sites. So who are the vaccinees so far? From UP constituents, these are A2 professor. We have Professor Emeritus at age 80 or 90. Meron pa rin at mga asawa nila. Retired faculty and staff, and faculty members and staff 60 years old and above. And those with A3, hypertensive, diabetic, obese, etc. From nearby communities, we've been working with District 4 barangays, and this week we worked with District 3. And we've administered Sinovac, AstraZeneca, and Gamaleya vaccines. So as our accomplishments for 17 days, starting from April 26 to June 12, that is 17 days, we never had a week that we operated for 5 days. Maximum, I think, was 4 days operations. For the first dose, we've done 2,698. For the second dose, 923. For a total of 3,621, something like 1% contribution to the Quezon City totals. By vaccines, we've had first dose of AstraZeneca, 180, Gamaleya, 677, Sinovac, 18, second dose, it was all Sinovac, 923. Highest number of vaccines so far was last Saturday, June 12, 599. I have statistics for June 14 and 15, over 500 vaccines, although I couldn't add this to the category, whether first dose or by vaccines yet. We have top 5 barangays we've helped so far. UP Campus, 1,400. Cruz Naligas, 250. Teachers Village East, Matandang Balara, and Pansol. And we really hope for a continuing partnership with Quezon City. Of course, that's the second dose for the first batch of AstraZeneca, I think sometime in May, June, sometime in August. And we hope to continue, of course, with the first and second doses of Sinovac, AstraZeneca, and Gamaleya. And hopefully we do first and second doses of Pfizer. Our freezer is already open. I mean, not open, but ready to accept the Pfizer vaccines. And in the last meeting with Sir Vico, they said we could request for honorarium for volunteers, especially medical volunteers who are really difficult to find, no? So this is the freezer, as I said, that is ready and free for Pfizer vaccines. I think this is minus 80 ba yun? Minus 80 Celsius. I have a few screenshots of how vaccinees have responded and posted their evaluation. Today had my second pleasant and expeditious vaccination experience at UP-CHK. Many thanks to UP COVID Task Force and the volunteers. And another congratulatory message. It took an hour and 10 minutes only to go through the whole process, the different stations, because the volunteer teachers and staff and marshals and medical personnel were all very knowledgeable, efficient, courteous, and accommodating. The gym was clean, including the toilets, logically partitioned, well ventilated, and all protocols were meticulously observed. And waiting in line, mahangin or breezy, as usual, efficient and friendly and staff. And second job done, 40 minutes, including the monitoring waits. And this is quite a long letter, 54 minutes, including the 15 minutes monitoring. Maaliwalas, fully ventilated, and a lot of trees outside. They couldn't feel the heat inside the gym. And the volunteers, of course, were highly appreciated. And they had tiger crackers this time. He had a quite elevated BP, so he had to wait quite a while. His overall rating, 5 stars. Kudos to the UP admin. And this one is also quite a long story. But he says he had a few notes on per station, but this is the best feedback we had so far. Anyway, for all my jibber jabber, he wants to say that very kind, efficient, volunteers were very good, and kudos to everyone. So I'd like to say special mention to our vaccination team, our overall supervisors, Dr. Alfred Tengonsiang from the University Health Service, Professor Dulce Natividad from Asian Center, our IT head, Jacob Obingwar from the Office of the University Registrar, our logistics heads, Ram Hernandez from CSWC, Dile Espino from OVCCA, with a lot of support from the members of the UP Diliman COVID-19 Task Force headed by our Chancellor Fidel Arnimeso. And kudos to all volunteers. You might have questions. You can email us at covid19.taskforce@upd.edu.ph. Thank you very much.
Thank you very much, Dr. Aleli Bawagan. It is truly an honor and a privilege to hear the updates from the UP community as a scholar ng bayan, as a health professional. I'm very happy to see the impact that the university has created when it comes to responding to the COVID-19 pandemic. So congratulations, UP Diliman, and of course, UP-CIFAL.
One minute. In case there are other universities who are still open to work with Quezon City, we're also willing to share whatever it is that we learned in the whole process. Thank you.
Indeed, honor and excellence all the way, willing to share the knowledge and experiences that they were able to gather to help hasten our march towards herd immunity. So once again, thank you very much, Dr. Aleli Bawagan. Now, let us now watch some testimonials from vaccinated UP personnel and volunteers with regard to their experiences as part of the UP Community Vaccination Drive.
Napakaganda po yung setup na nagawa dito. And so nagpapasalamat din ako sa UP family natin na binuksan po ang kanilang venue at agaran na natugunan yung program nitong ating mayor, Mayor Belmonte. So ang prayer ko lang po na sana tuloy-tuloy po na ma-inoculate na lahat ng mga Q citizens natin, and most of all, magandang system po itong na-set up ng UP campus. And I pray that even other cities can learn from their setup dito po sa pag-inoculate natin ng vaccine.
Yung bakunahan sa UP Diliman ay isang malaking hakbang at malaking responsibilidad din ng UP bilang isang universidad na may mandato ng serbisyo publiko o yung pagbibigay serbisyo sa komunidad at sa pangkalahatan ng mga mamamayang Pilipino. So malaking hakbang siya para mataguyod natin yung paglaban natin sa pandemyang ito.
So, since nag-start yung bakunahan noong April, I see na it's very organized. Maayos siya. So, alam ng mga tao kung ano yung mga gagawin nila. So, I think naman very smooth yung flow ng bakunahan dito sa UP Diliman. Pati yung gym, very maaliwalas, no? Hindi siya yung mainit. So, kahit maghihintay, okay lang din siya.
Isa itong magandang idea upang makatulong ito para sa ating mga barangay at sa mga nasusukupan din ng UP. So far, nakikita ko na sobrang systematic dito at mas madali natin na-reach yung mga tao.
Malaking challenge ito sa part namin, lalo na ngayong nasa gitna kami ng pandemya. Ang mga maninita ay walang kabuhayan sa ngayon, pero sa kabila ng na wala kaming kinikita, wala kaming kabuhayan, mas pinili pa rin namin na makapagbigay, makapag-contribute tayo ng tulong sa community. At isa pa rin factor na pag-encourage sa amin yung mga kasamahan namin sa community, yung mga taga-academe na na-encourage din kami at naging inspirasyon din namin yung ginagawa nilang pagtulong dito sa community. Since wala nga kaming kabuhayan, kesa nakatenggal lang kami sa bahay, mas pinili namin at minarapat na magbigay ng serbisyo.
Dito po na napakaganda po kasi maayos siya, tapos yung pagkakasunod-sunod ng kaya okay siya. At saka yung pinapaliwanag nila sa tao kung para saan yung bakuna at kung anong kahalagahan niya. So napaka-importante at maganda yung sistema nila.
Actually, maganda naman yung first experience ko dito. And grateful din kasi yung barangay namin is nag-offer naman sila ng service. Then maganda naman yung sequence na gag-guide ka ng mga naka-volunteer naman na nag-handle. So, thumbs up.
Napaka-importante po ng bakuna para sa atin, lalo-lalo na sa ngayon. Dahil para sa pamilya natin, para sa sarili rin natin, at the same time, para hindi rin tayo makahawa sa ibang tao.
Importante kasi gaya ko nagtatrabaho, kailangan din namin sa trabaho namin, tapos para iwas sa COVID-19.
Yun nga, kailangan nilang mabakuna kasi mas na mahawa sila, may protection sila sa katawan nila.
Siyempre mas maganda po i-encourage natin sila na magpabakuna. Huwag silang matakot sa side effects nito dahil sa mga naririnig nila sa iba.
Right now, the important thing is we need to educate them. Bakit ba natin nila magpabakuna against COVID-19? So gusto natin kasi maprotektahan yung magprotektahan tayo na hindi tayo magkaroon ng severe or critical na COVID. Yun naman talaga yung protection na binibigay nito mga vaccine.
Kung may mahal po tayo sa buhay, and lalo na kung umuwi tayo sa mga bahay natin, much better talaga magpabakuna tayo. Not only for us, but for our family, syempre. Ayun, magpabakuna na po tayo.
All right, there you have it. I personally was vaccinated in Quezon City, and it has been a wonderful experience. Hopefully, we can encourage more people to get vaccinated sooner rather than later. Now, we have another speaker with us this morning, and he is actually from a very integral institution, especially when it comes to addressing the COVID-19 pandemic. He holds a medical specialist MD degree, particularly in community medicine, from the University of Colombo in Sri Lanka. He also has a Master of Science degree in biology and control of disease vectors from the London School of Hygiene and Tropical Medicine, and a diploma in tropical medicine and hygiene from the Royal College of Physicians, also in London. He has served as WHO in the Western Pacific Region Office since 2011 in various capacities. And from 2015 to 2019, he was the coordinator for malaria and other vector-borne and parasitic diseases at the WHO. He was also acting director for communicable diseases in 2018 and 2019, and WPRO's regional entomologist and technical officer for malaria in Papua New Guinea. He was the acting director for health security and emergencies at the WHO Regional Office, or WPRO, from April 2020 to June 2020, supporting the regional response for COVID-19. Currently, he is the World Health Organization's representative to the Philippines. Ladies and gentlemen, let us all give it up for Dr. Rabindra Abiyasanghe.
Salamat po, Dr. Dexter Gilliban. Really happy to be here with you. A very good morning to the esteemed participants and the speakers of this event. I want to acknowledge Mr. Joseph Juico, of course, Professor Alaili Babagan, the Vice Chancellor of the Community Affairs of the University of Philippines of Diliman. It is indeed a pleasure for me to be here on behalf of WHO. It is also a reflection of the importance we place on community ownership and community empowerment in not just the vaccination, but in the entire COVID-19 response, which we recognize as critically important, not only from a health perspective, but also from an economic perspective. So I want to reiterate that WHO, while supporting mitigate the health impacts of the COVID pandemic by reducing transmission, reducing deaths, and reducing severe cases, also emphasizes the need for management of the pandemic in such a way that minimizes the disruption of economic activities. So from that perspective, I want to start by saying that we view vaccination as an integral component of the entire response. Vaccination is not the silver bullet that will end the pandemic. It is not going to help us to get back to normal as we knew. But if the vaccines are used appropriately as part of the entire response, we could expect to maximize the impact of the vaccines, and we could expect to come out of the adverse effects of the pandemic earlier. And this is why I thought it important that I spend time with you today, firstly, to acknowledge the very critical, important role that the community, the academia, in this case, the UP Diliman, can play in the response, but also to encourage other sectors to join the whole of government effort that we have in this country and also in many other countries to address the pandemic. So let me start by saying that what we know about the, let me start by first complimenting Quezon City. Quezon City is the largest city of the 17 cities that make up NCR. And I believe you have a population about a little over 3 million people. And it's not surprising that Quezon City has had the largest number of cases being reported in NCR in any given city. So that is also one of the reasons why I thought I need to make time to join this meeting. The other issue is that we have actually been working with the Quezon City CHD and supporting the office of Mayor Joy Belmonte in the response for many, many months now. And so it's always a pleasure for us to engage with Quezon City and to understand what is happening, to appreciate the good things, and also to encourage improvements. We are now seeing a relative calm in the NCR. But I say relative because we haven't seen a flattening. We have seen a plateau at a relatively high level. We have a positivity rate hovering of about 9%. But if we look at adjoining region 3 and 4A, we are looking at a positivity rate of double that. So we are at significantly high risk levels because of the considerable movement of people between region 3 and 4A into NCR and out of NCR. And that is why we continue to emphasize that we need to do everything to enhance preparedness, to follow the minimum public health standards, and to ensure that the non-pharmaceutical interventions are complied with. At the same time, while emphasizing all of this, it becomes imperative that we use the vaccines rationally. Now, I'll start by explaining what the vaccines can do. What we know up to now is that the vaccines that WHO has certified are capable of preventing severe disease and deaths. That we know. So countries that have used the vaccines appropriately have seen a significant decline in severe cases, meaning decongestion of the health facilities, and very marked declines in deaths, almost reaching zero. But that is subject to the vaccines being used appropriately. Let me clarify what I mean by that. If we look at the COVID-19 pandemic in the Philippines, 90% of the deaths that have been reported are in people above 45 years. 90%, 90. And the proportion is much higher in the higher age groups. Because what we know about COVID-19 is if you are infected with COVID-19, the older you are, the more likely you will develop severe disease, the more likely that you are likely to succumb to the infection. If you have comorbidities that are uncontrolled, you run a risk of severe disease and increased death. So that is why early on, WHO defined a prioritization. We recognized the key role played by healthcare frontliners who were defined in the Philippines as the A1 group. Then as a second, that was important because we need to keep the health centers fully functional. The second priority group was the elderly, the over 60s, right? And here in the Philippines, this group was classified as the A2 group. And then those people affected by comorbidities were included in the next prioritization, which is known as the A3 group. And then A4, you have the economic frontliners, and A5, the indigent populations. This is the prioritization we recommend, and which the government of the Philippines has agreed to follow when they signed on to the COVAX initiative. Now, COVAX is the initiative that was initiated by WHO, the Coalition for Pandemic Preparedness, and the Gavi, to ensure that vaccines can be provided to low and middle income countries. And we committed to provide the Philippines with vaccines enough to protect 20% of the most vulnerable, and the 20% of the population who are considered most vulnerable are in those groups that I mentioned. So it is imperative that we use the vaccines to scale up the protection of those groups quickly, because as I mentioned, we are going to see increases in transmission in the future. And if we haven't used the vaccines to protect those groups, we're going to see a repeat overwhelming of the healthcare facilities, and the healthcare workers are going to require that to stop the facilities being overcrowded and flooded, that we need to go into another lockdown, to another ECQ or a MECQ. So the rational use of the vaccines from a life-saving perspective and an economic revival perspective is to actually vaccinate these priority groups. Now I come to what are we achieving in the vaccination side, and we want to compliment the Philippines. You have now vaccinated more than 7 million people. 1.9 million people are fully vaccinated. 5.2 million people have received their first dose. This is the data I had yesterday. It's probably higher now. For Quezon City, we want to recognize that you have nearly 390,000 people with first dose and 124,000 fully vaccinated. But if you look at that as a proportion of your population of 3 million, that's still very small. So if there is a surge again in Quezon City, it's very likely that your facilities are going to be overburdened. Now, if we are to prevent that, we need Quezon City to primarily target the A2 and A3 groups. This is what we are advocating. What we hear is that the coverage is difficult. The A2 group coverage is still 20%, 21%. For NCR, it's about 27% for the first dose. It's not enough. We need to increase that much more. It needs to go to 60, 70% as quickly as possible. The faster we do that, the less the impact of the next surge is going to be. So we have a narrow window. As we get vaccines, we need to use them rationally. And it's good that you have in Quezon City the Protectodo. You have established 3,000 beds in 11 different facilities. You have facilitated barangay assisted bookings. And I want to actually compliment Vice Chancellor Alay Babakan and the UP Diliman for their proactive approach in partnering with Quezon City to actually facilitate the vaccination. This is the way we need to go. We need to, because let's be frank, we are looking at a group of people who were asked not to step out of their houses. They have stayed in their houses for the last 18 months. Now we are telling them go out and get a vaccine. But if our vaccination sites are crowded, if they have to spend 6 hours there waiting for the vaccines, you shouldn't be surprised if they're reluctant to go, right? So this is why we are continuing to emphasize to say that we need a two-pronged approach to increase coverage in the A2s and A3s. One is actually convincing them on the usefulness and the safety of the vaccines. And the second part is actually convincing them on the safety to go out and get the vaccine and come home. And for that, we need to give them the confidence that the vaccination centers are not overcrowded, that they can go there, get their vaccine and come out. I like your slide where you said they can come to the vaccination center and be out in 28 to 30 minutes. That's wonderful. If that can be always the case for everybody, every senior citizen who comes to a vaccination site. That's why we are advocating that we need to rapidly increase the number of vaccination sites. I did a quick calculation. You have 131 vaccination sites in Quezon City. You want to vaccinate 1.8 million people. Do the maths and see how many people will need to be vaccinated on a daily basis to reach that by end of September. If you're not going to do that, because it's going to be a huge number, that means that you need many more vaccination centers. You need new approaches to reach these populations. So that means the bus you had is a very good example. Going into the Puroks, into the CTOs, into the barangays, reaching out to those people who are housebound, reaching out to people who cannot come to vaccination sites, going house to house. That's the way we can do the vaccination in these groups quickly and protect them. If we don't do that, we lose the maximum benefit of the vaccines. And we potentially looking at having either those, I can't remember the number, I think it was 300 limited lockdowns or large-scale lockdowns. We don't need to go back to that, because if we have to go back to a large-scale lockdown, again, it's negative economic growth, people losing jobs, people going hungry. The way to prevent that is that we need to vaccinate the elderly and the senior citizens, the comorbids. Let's do that. By having a vaccinated workforce, we can kickstart the economy. But if we haven't vaccinated our elderlies, we're going to go back into lockdown, and all the advantage of vaccinating the workforce is going to be lost. So we have to be very clear on this. The priority should be to create avenues to protect the most vulnerable. Once we have done that, we can move to the other groups as more and more vaccines become available. So let's work towards that. Let's work to ensure that what you are doing in Quezon City, the great community partnership, the partnership with the private sector, the partnership with the malls, the academia, we build on that, because ultimately it is good for the community to own not just the vaccination, but the entire response. Because if they own it, they will take ownership to preventing infections, to ensuring people are vaccinated. And that is why we continue to urge that it is now the local government units, it is now the local chief executives who need to proactively facilitate this vaccination in the next few weeks and months, so that we quickly vaccinate these most vulnerable groups. We can then move to the other groups. And then once we have the vulnerable vaccinated, the economy will stay open, and we can vaccinate more and more people and get the economy up quickly. So that should be our strategy, and we need to do everything possible to encourage that. So while I'm really impressed and happy with the initiatives demonstrated by UP Diliman, with the fact that they are using community volunteers, they are using medical volunteers, the leadership shown by the QC Health Department and the mayor are really commendable. But I think we need to scale it up a notch more. We need to get far more people vaccinated. And as you wait for vaccines, now is the time to do that. Now is the time to facilitate the registration, so that as vaccines come, we can vaccinate more people. We expect the Philippines to receive 10 million vaccines this month. And Secretary Galvez said, we are expecting 11 million vaccines next month. It could probably be higher if we can work out the dose sharing with the donor countries through COVAX. But then the systems need to be able to use the vaccines rapidly, right? Right now we are working at, last week, the highest vaccination rollout was 218,000 in a day. But if we are to actually consume 10 million vaccines in a month, we need to use much more in a day. We need to double that. So that will happen only if we do that at the lowest possible administrative region. We need to keep doubling that capacity everywhere so that we can consume the vaccines that will be coming and we could bring back normality as quickly as possible. So I really want to take this opportunity to thank the Quezon City Health Department, the Office of the Mayor, and my most sincere thanks to UP Diliman and all the other partners who are partnering in this effort. We are really encouraged by this. We really salute you for this commitment, and we encourage you to continue to work to support the recovery and the response to this pandemic. Thank you, sir.
Thank you very much, Dr. Ravindra. And that was our third speaker for this morning. And I hope that everyone was able to learn a little bit more about how the academe as well as the local government can work together to advance our collective action towards addressing the COVID-19 pandemic. And with that being said, we are now opening the floor for questions from our audience, both here in this call and also on our Facebook and YouTube feeds. So please send your questions in, and hopefully our experts would be able to answer them for you. But first up, I already actually have questions from our audience here. And I think this one is very relevant, and this is one of the most common questions that people have with regards to the COVID-19 vaccines. I think Dr. Ravindra would be able to answer this the best. The question is, how long does protection from COVID-19 vaccine last?
Very good question. Unfortunately, I don't have an answer. The projection is that they will last more than a year, but it's only real life experience that will show. The first vaccines were administered only in December last year. So we have no real life experience on how long the protection will be. And then we have the added issue that the virus is mutating. There are new variants appearing. And it is unclear how effective the vaccines will be in dealing with future mutations. The current mutations, we know that the vaccines still remain effective in preventing severe disease and death. But we have to be open to the possibility that a future mutation may change that. So this is why we are saying we need to use the current vaccines to deal with the current transmission and bring it under control as quickly as possible. And there may be a need for us to use a booster dose. When would be the best time for that? We don't know. Only real life experience will show us. So what we know now is that by using the vaccines, we can prevent severe disease and deaths. So let's do that.
All right. Thank you very much, Dr. Ravindra. And now we have a question from Mr. James Dan Benedicto, and his question is, what are your thoughts about giving vaccination to in basic education so that they could go back to school? I think we could have the perspective of both the health as well as the academe and even the local government when it comes to this question. So maybe we can start with Dr. Ravindra.
Sorry, I missed out the question. There was a break in the communication. Can you repeat it again?
Right. The question from Mr. James Dan Benedicto is, what are your thoughts about giving vaccination shots to millions of students in the basic education sector so that they could go back to school already? So this has been a major concern. COVID-19 disrupted the usual flow or conduct of education. So this has impacted local government.
That's fine.
So Dr. Ravindra?
So the issue is that right now we have 8 vaccines that have been granted emergency use listing by WHO. But it's only one vaccine that has been cleared by the US FDA for use in adolescents and children above 12 years. We are still looking for evidence of safety of the vaccines in children. So we don't believe that we need to vaccinate children as a priority now because we don't see a lot of infection among children, nor do we see a lot of severe cases among children. I'm not saying that it doesn't happen. It does happen, but the numbers, relative numbers are less. So the way we see it, we will be in a position to open the schools once we have the seniors vaccinated and probably a large proportion of the working population and the teachers. So we are optimistic that, and we really do hope that we can support the Philippines to achieve high vaccination coverage in the short to medium term, so that you are ready, hopefully, to open up schools for the next academic year. But opening up schools will not be going back to school as we knew it. There may be a need for phased opening up schools. Not everybody goes to school every day, but a certain proportion of children can start going. We have to work out how we can do that in a safe manner so that we don't precipitate another increase of transmission. So that's something that we are discussing with UNICEF and the Department of Education and the Department of Health. So we are hoping that we can come up with some recommendations. Of course, it depends on the primary factor will be what is the dynamics of transmission in the community. So if you are seeing increasing transmission, you can't consider opening schools. But if you're seeing declining transmission, if you're seeing a decongestion of the healthcare facilities, it may be safe to open schools, but it needs to be done in a phased manner. So that needs to be planned. We need to provide access within schools for children to have hand hygiene, washing their hands frequently. All of that needs to be facilitated before we really open the schools. So a lot of preparatory work, a lot of discussions happening at this point of time. And we are really hoping that with the increased quantities of vaccines coming in, that we could potentially look at some kind of face-to-face schooling starting probably in the next academic year.
Thank you very much, Dr. Rabindra. Perhaps we can take the thoughts of Professor Bawagan, Vice Chancellor Bawagan, as well as Councillor Rico, particularly their insights on the impact of this proposal, possibly on the academe as well as the rollout of vaccines for local government. Any thoughts, Professor Aleli and Sir Rico?
Yeah, of course, we've also been thinking about that, how University of the Philippines can provide vaccines to our students, and especially since they're over 18. And of course, that can only happen once CHED approves which courses can open for face-to-face classes. Although we were also thinking if since the vaccines don't cost that much, let's say over less than 2,000 pesos for 2 doses, how UP can provide that as a benefit for students. So we're still thinking how that can happen. Although it can also be done through the CHED free tuition mechanism, if they can still provide that as an additional benefit to students, not only for tuition, but that amount, less than 1,500. And if that can be, let's say, sourced from the CHED funds, it's still part of the ongoing, let's say, planning and conversations between CHED and UP itself in terms of its planning, procurement, and budgeting. If that can happen, then we'll all be happy because, of course, classes are much better face-to-face rather than like this. Thank you.
Thank you, Vice Chancellor Aleli. Sir Huico, any thoughts when it comes to Quezon City's response to that potential proposal or that potential rollout for children?
Well, as Dr. Rabindra said, no, at the end of the day, we also follow guidance coming from the national government, particularly the Department of Education. And at the moment, the priority for the people to be vaccinated are those in the A1, A2, A3, and 18 years and above. And definitely once once vaccines are made available to students, we will be more than happy to vaccinate our students, because as based on reports, there is also a slight decline in terms of the educational attainment, or the educational quality that is being done as compared to having a face-to-face type setting. Given that Quezon City coordinates with our local school board, and we deal mostly with our high school and grade school students, no, and majority of which are still under 18 years of age. So rest assured, Quezon City will be ready as soon as we get the go signal, as soon as we have the vaccines, as soon as we get the recommendation also coming from DOH. Yeah, thank you.
Thank you very much, Sir Rico. And we have another question here. And this one is asking, if the person is pregnant, can they be vaccinated, and will there be a difference in the side effects that they will feel? I think Dr. Rabindra would be the best person to respond to this question. Dr. Rabindra, any thoughts, sir?
So vaccines are recommended for pregnant mothers. It depends on the intensity of transmission. So if the intensity of transmission is high and the protective efficacy of the vaccine will be considered an advantage, we recommend that pregnant mothers are vaccinated. This is the WHO position. The national government may adopt that accordingly.
All right. Thank you very much, Dr. Rabindra. And here we have another interesting question. I think this will require response from the medical team, as well as the academe, as well as our local government. Do I still need to wear a mask and avoid close contact with others if I'm fully vaccinated? And how will local government apply or implement this, if ever? So I think we can first go with Dr. Rabindra with regards to this one.
Yeah, so I sort of partially answered this question already. It is an important question, but the information we currently have is that the vaccine only prevents severe disease and death. As regards to the efficacy of individual vaccines in preventing transmission, that we are still studying, right? We are looking at countries and what they are doing. So in some countries that have reached high vaccination coverage, like Israel, they are recommending relaxation of these rules. But the issue is that for them, I think they've achieved more than 65% coverage now of population. So when you reach those kinds of coverage, you could possibly consider that. But even for them, even reaching that kind of coverage is not a straight one-off answer, because we also need to look at which vaccines did they use to reach that coverage, and which vaccines did we use? What is the relative efficacy of the vaccines we used? So all of this needs to be considered, and we are sure that the evidence will emerge as time goes by. But at this point of time, we don't have the evidence. And so we continue to say that since we don't have the evidence, it's still prudent to wear the mask, to follow the physical distancing, because we still don't know how many people are vaccinated, right? If you take the Philippines, you have a vaccine coverage of about 2%. So you go out there and meet 100 people, 98%, 98 of them are not vaccinated. Is it safe for you to be without a mask? Probably not.
All right. Thank you very much, Dr. Rabindra. Does anyone want to add? Because we actually have a follow-up question from Ms. Patricia Ayola. Yes, Professor.
Dr. Dexter, yes. What Dr. Rabindra said, that it prevents severe and deaths. It's true. That's what the study says. So far, that's what we've been telling vaccinees. It doesn't mean you will not get sick. Just like any other vaccine. For example, you get the flu vaccine, it's not 100% sure that you won't get flu, but you will not get the severe symptoms. And we have cases in our Molawi isolation facility where COVID positive have been vaccinated twice. They've completed the 2 doses, but they still got COVID, although their symptoms are maybe mild, or some of them are even asymptomatic. So whether they are able, I think, is it right, Dr. Rabindra, that you are not able to transmit the virus because you've been vaccinated? I think that's one of the things that is it right to say that you are not able to transmit? Anyway, so we've had cases of vaccinated people who still got the vaccine. So that's what we tell the vaccinees: still continue your minimum health protocols with your mask and wash and physical distancing. And we tell them that so that they don't get complacent that they have the vaccine. They can take it away, they can mingle with people, etc. But
Yeah,
that's a
so
question, Dr. Rabindra. Yeah.
yeah, no, yes, Professor Valiman. So the issue is that with the vaccines, you won't get severe disease, and that would explain that you have some degree of immunity. So the virus replication in your respiratory tract is lower. And so if you cough, if you sneeze, even you talk, the number of viruses you're sending out will be limited. But it depends on your degree of close contact. So even a low number of viruses, you could infect somebody if you are in very close contact, if you're right? And that is why we continue to say, wear your mask, prevent that happening, right? Even though you're vaccinated. It's good for you, it's good for the people who are vaccinated around you or unvaccinated around you.
All right, thank you, Dr. Rabindra. Yes, Sir
Yeah,
Quico.
if I may add, I guess there's always a misconception. I think it all boils down also to messaging, because we've got a lot of cases where, and even if one person has been vaccinated with the first dose, they feel like they're invincible all of a sudden. So we have to keep on reminding them that, number one, you need 2 doses, and second, it doesn't necessarily mean just because you've got 2 doses, you can no longer get COVID. You can. And you can still infect other people, especially those that are not vaccinated yet. So we've been ramping up also our messaging and encouraging people to get their second dose. So far in Quezon City, about 5%, it's a number of people that haven't gotten their second dose when they have scheduled their second dose. So we're trying to reach out to them to remind them that they need to be fully vaccinated for them to be so that they will be protected and prevent them from getting severe COVID. So, but the message has to be clear. You can still get COVID. You can still cause another person to get COVID, especially those that are not unprotected.
Thank you very much,
If
sir.
I may add, Dexter, the 1 dose will give you limited protection for a limited duration of time. And that level of protection starts weaning off and weakening after 12 weeks. So unless you get that booster dose, which gives you then the longer term protection, you are putting yourself at risk, and actually you're losing out on the advantage of getting vaccinated if you don't complete your 2 doses.
Thank you, Dr. Rabindra. As a matter of policy, there's actually a follow-up question to that. What are your thoughts on the necessity of wearing face shields? Would they still be recommended by the WHO? And in terms of policy, will this still be enforced by local government?
There is a lot of discussion around this topic. The WHO has no firm policy on face shields. So we support the government's position. Of course, we know that the DOH is reviewing this, and as vaccination coverage increases, there may be a decision on whether face shields are necessary or not. But we haven't still seen the kind of vaccination coverage that will provide for that relaxation. So I think the discussion is important, but it's a little premature.
All right. Thank you very much. There's actually a question here, and I think this will require, again, another tandem approach from the medical field as well as government. Given that there is an uncertainty with regards to the timeline for the necessity for a booster dose, as mentioned by Dr. Rabindra, it can possibly be a year or so in terms of the effectiveness of the vaccine. The question is, should they already start preparing or pushing or even lobbying for the availment of a booster dose or a vaccine, another shot of the vaccine, probably by next year? And would the local government be open to providing assistance with this regard, if ever?
So let me handle that question from a different angle, because we are not quite clear when the booster dose will be required. But what is important is to recognize that we need the primary dosing for everybody first, right? So we need to achieve that as quickly as possible. Then once we are clear, we need to plan for the potential need for a booster dose. Now, the issue is that at this point of time, there are no COVID vaccines that are authorized for sale, right? They are all bought by national governments, because governments need to guarantee and indemnify the manufacturers, because they are only authorized for emergency use. They are not authorized for marketing. So the manufacturers are still running a risk that somebody could prosecute them for side effects, and that's why they want the government to indemnify them. And this is the arrangement we have. As time goes by, as more evidence is collected and vaccines are authorized for sale, then private entities and local government units will be able to buy vaccines as and when they need. At this point of time, we have to depend on national mechanisms.
Thank you for that, Dr. Bindra. And we'd like to ask the Quezon City government, if ever, what would be your position on this one? Would the additional vaccines potentially be covered by the Quezon City government? What are your potential plans in the event that there would be a need to get another round of vaccines for even those who are already vaccinated this year, possibly even next year?
Well, my wish is when the time comes, when a booster shot has already been developed, I hope by that time the vaccines will be commercially available, because it's very difficult to do another rollout like this, to vaccinate and purchase vaccines again for the entire population. I hope once it's commercially available, at least the Quezon City government can focus on the indigent population. That's what's more important. So I'm crossing my fingers that hopefully when that time comes, it can be commercially available, because I tell you, it is very difficult to do what we are doing right now. Yeah, thank you.
Definitely, we can already feel the impact not just on the health system, but even on all of the partner institutions with regards to the rollout of the COVID-19 vaccination drives. So with that being said, perhaps we could get final thoughts from our esteemed panel of resource speakers today regarding their stance about the local partnership of the academe as well as government, and their thoughts about what we can do best in order to address the issue of COVID-19 in the Philippines. Perhaps we could start with Vice Chancellor Aleli.
Yes, as I said in my presentation a while ago, that we commit to continue the partnership with Quezon City. We're very thankful for the trust that they gave us, that we could operate this vaccination site. And yeah, it is our mandate for public service as a university, and we continue to hold on to that mandate, and to fulfill our commitment and our, let's say, responsibility to our nearby communities, not necessarily just nearby. If people from District 2 or the other districts can come to the gym, that we are willing to operate the vaccination site as long as we are needed by Quezon City. Thank you very much.
Thank you very much, Vice Chancellor. Perhaps we can hear the message of the city government of Quezon City from Mr. Joseph Wico.
Well, first of all, thank you for having me. I want to thank also Ma'am Aleli for your support, and the entire UP community for helping Quezon City. Thank you also for committing to be with us till September. It's for us to reach that population protection, herd immunity here in Quezon City, and hopefully the entire country. I also like to thank Dr. Rabindra. Sir, Ms. Wen Capistrano has been helping Quezon City a lot. She's been guiding us on what to do and what not to do to fast track our vaccine rollout in Quezon City. Rest assured, I think all of us here have the one common goal, is to have everybody vaccinated and to lessen the deaths of people dying due to COVID. And hopefully we reach our target soon, because we all want to live a normal life. We all want to move on. We all want to hug our families and be with our loved ones. So we're doing everything that we can. Rest assured, as long as everybody's working hand in hand to fulfill our dream for protection and getting closer together with our families. Thank you very much.
Thank you very much, Sir Huico. Actually, we have a comment here from Professor Edna Ko, and she says, listening to the discussions today, the way to go is the QC UP way. Reach out to the barangay communities, and the great partnership owns safety and health. So with that being said, perhaps we can hear the final message of Dr. Rabindra.
Thank you so much, Dr. Dexter, and it has been a real pleasure for me to join this panel with Professor Ale and our task force chair, co-chair, Joseph Joico. Again, a very big thank you to the Quezon City Health Department and the government of Quezon City for its very proactive response to COVID-19 pandemic, and the way they have been working towards improving the response. Besides Wen Capistrano from my office, we believe we are also working with Dr. Cruz to strengthen the contact tracing and management in Quezon City. This is a critically important element of the response that we want to see improved. This will help to keep the economy open and not necessarily go into lockdown, as important as getting high vaccinate coverage. But again, let me re-emphasize that given the current global constraints with vaccine supply, we need to re-emphasize the need to follow the prioritization. And if you're going out of the prioritization, again, I would say prioritize the people above 40 years. Don't use vaccines for people below 40 years at this point of time, because the benefit of the vaccination will be minimum by doing that, and you are potentially looking at going into new lockdowns. So keep that in focus and try to create avenues together with UP Diliman and other community partners to ensure that the priority groups can access vaccines and have the confidence to receive those vaccines, so that we can continue to strengthen your pandemic response and come out of the pandemic as quickly as possible. So we salute you for your efforts and continuing commitment. And I want to re-emphasize that WHO will be committed to supporting you in whichever way you want us to support you. Thank you so much.
Thank you very much, Dr. Rabindra. And there you have it. Today, we have seen the value of multi-sector collaboration, and we have seen the impact that is provided when different groups and entities come together to form nation recover from the COVID-19 pandemic. We've seen here the World Health Organization, an international global institution, hoping to provide assistance and knowledge to everyone in need of championing the COVID-19 vaccination drive. And we have the academe here providing avenues for collaboration, using its own facilities in order to help distribute vaccines, as well as encourage people to become part of the solution. And of course, this is fully enabled by the local government, particularly in this case, Quezon City, by providing the technical assistance, manpower, even support in order to ensure that we are able to protect every citizen of this country. And at the end of the day, that is why we are here. We're here to unite in order to achieve herd immunity. So once again, I'm Commissioner Dexter Galban from the Commission on Population and Development under the National Economic and Development Authority. And this has been Community for Immunity, Partnerships for COVID-19 Vaccination Programs by UP-CIFAL, the Quezon City Government, and the World Health Organization. Thank you very much, and may you all have a pleasant day. Thank you, everyone.